Hello, everyone. Welcome to today's episode of Women with Uchi. Egby, how has your year been? Want to believe God that by His grace, all things are working together for our good. Praise God. Now, today's topic is on factors affecting intending couples as related to genotype and blood group. And we have a very special guest in the house this afternoon, and her name is Dr. Essien. She's a consultant, teaching hospital, you know, and she's going to share a lot of light today, as in this topic. By the grace of God, God is going to be helping her to teach us what we need to know about genotype, blood group, before saying I do, because it is not a joke. Believe me, it's not a joke. Love is not enough. So before she takes the stage this afternoon, we're going to be reading Genesis 1:27. Let's look at what God says about us, male and female, create his creation. He says that in for Genesis chapter 1, verse 27, God says, He says, God created man in his own image, in the image of God created he him, male and female created he them. God created us in his image. And because he created it in his own image, we are perfect. So whatever we're seeing that is imperfect in our lives or in our marriages today, it is not God. It's actually the devil and our ignorance too. So by the grace of God, Dr. Essien is going to be shedding some light into this to give us, so we can have some understanding of what we need to know and how to prevent pain and misery in our marriage. Praise God. Dr. Essien, welcome one more
Thank you,
time.
Ma. Thank
It's
you so
an
much,
honor.
Ma.
It's a big honor to have you here. And Dr. Essien, I just want you to help tell our viewers what they need to know, the factors and the things that they need to know before saying I do.
Thank you, viewers. Well, blood group is what I call it, the blood type that every individual has, human have, and it's determined by what we call antigen that is found on the red cell. Everybody has red blood cell on the red cell of the individual. So if you have the A antigen, you belong to the blood group A. If you have the B antigen, you belong to the blood group B. Then those that we call O, which I'm sure most people are O blood group. You keep hearing blood group O, blood group O, are those that don't have any of the antigen on the red cell. Then the AB, I'm sure few people are also AB, are those that have both the A and the B antigen on their red cell. Now, when you have that, the only issue you have, which doesn't really affect intending couples in actual fact, is at least the knowledge of it will help what we present ABO incompatibility in the mother for the child. If you are O and your child is A or B, the likelihood of what we see that jaundice, that you see baby is being born and you see them having jaundice immediately can occur. Then we have what we call the rescue factor. I'm sure a lot of us viewers have heard of rescue factor, where you say, oh, I'm rescue positive, I'm rescue negative. It still does not affect intending couple, but it helps you to prevent the outcome of your child. I'm not saying if your wife is rescue negative, you shouldn't marry her, or if your girlfriend is rescue negative, you shouldn't marry her. But the knowledge of having it will prevent you from having problem with stillbirth, having problem with having children that are born and they are so jaundiced that most times they have to do what we call exchange blood transfusion, and those are costs. A mother just gave birth either through CS or normal delivery, she's supposed to go home and rest, but yet she's battling at the hospital because of a child. So if you have the knowledge of it before marriage, it will also prevent you from having these other problems. Then for the genotype, that is where the cocoa is for intending couples. If you have genotype, is the genetic makeup of our individual blood. And we have what we call the AA, those are the AA, we have the AS, we have the AC, we have the SS, we have the SC. Some people even have what we call the CC as genotype. And this affects, because genotype are inherited. Your biological parents give you this genotype, your genetic makeup. So you have to determine, just like the same way people say, oh, marry a woman that is intelligent, marry a tall woman, marry a short, so that your child will be like this. It affects your blood also. Now, if you have, what I call it has to be compatible. So you do not have a child that has sickle cell disease. the issue of all this, they say prevention is better than cure. Of what's talking about this genotype is preventing an intending couple having a child that has what we call sickle cell disease. So if you are AA, you can marry anybody. Even the SS can be married by the AA, knowing that your child definitely is going to be AS, or your children might likely be AS if you have an SS. Now, if you are AS, you cannot marry an AS because you have a 1 in 4 chance, which is a probability you cannot even say whether it's the first, whether it's the last, whether it's the middle, or all your children can have this sickle cell disease. And having one is enough problem. We call them warriors. Having one warrior is very capital intensive, is very burdensome to the family. It affects the child also because the child is dropping out of school all the time or not going to school because of health issues. So it's a lot of psychological, emotional, religious, everything you can think of burden on the family.
When we're in school, we thought, when you marry, when AA marry AS, it's just one. So what you're trying to make us understand now is that the whole 4 children could actually be AS.
Yeah, AA can marry AS. That's why I said AAR, what I call it, the people that should be sought after in marriage, because AA can marry anybody. They can even marry the SS, they can marry the AS, they can marry the AC. Their children will come out without any of these sickles. There's the sickle cell anemia. But when I'm saying AS with AS, is a probability thing. When you throw a dice, you don't know which of them will turn. So it's a probability thing. You can have one, you can have all, you can have none. So it's a probability. So are you ready to gamble the future of your child on a probability?
Okay, doctor, we've heard a lot of people say, "Oh, I love him. Oh, I love her." When we get married, we'll go. We'll just be there for one another. Is love really enough when sickle cell is child is involved?
Well, I don't know if love is enough because I've seen a lot of marriages that the father has walked away because of the burden of the child, and eventually says, "Oh, madam, take care of your child," and it's difficult on the family. So I don't think the love is enough. I don't think love is enough. Fine, they might be there, but the child feels bad. You hear some children saying, "Oh, my parents are not taking care of me. My parents are not concerned about me. My parents don't even bother about me, whether I live or I'm alive or dead." Because the parents are also tired. Right from childhood, it's not a disease that you get over. Neither is it a disease that there's there's an end. Maybe if you get to the age of 20 or 25, you won't have any problem. It's not like that. It's till you die, you have the problem. You keep having all these health issues. Maybe fine now because of advancements in medication and advancement in the medical technology, things are done to ameliorate and better their living standard. But once in a while, they still come down with crisis.
Okay, doctor, please. I want to ask a question about the blood group. Now, what's the best blood group? When you talk about the best, I know that there's nothing like best, but which do you think, is better than the rest?
Now, for the blood group, there is no best.
Okay.
Because the blood group is just to know your blood group, so that you can know in case of transfusion. For intending couple, you can. Some people use it for paternity in quotes, but at least in terms of transfusion, you know your blood group. Then for the mother, if you know your blood group and you have a child, if you are O positive and you have a child that is an A or B, you know that the likelihood of that fetus, that child, that's when the child is born, that's when you can know that having maybe what we call hemolytic disease of the newborn is there. And so the likelihood of the child having jaundice, these are things that make us to more of preempt, and we are planning towards the management of that child. So we prevent the complication of the disease. If you're a woman and you're Resu negative, that's for the blood group side, and your husband is Resu positive, and your child comes out to be Resu positive, if your first child comes out Resu positive, you don't have any problem, but you have been sensitized. What we mean, antibodies have developed, that your child has sensitized antibody. These are two negative things. Positive and negative don't match in an individual. God has been, so wonderful in the way he creates you. Things that, so the body sensitizes antibody. So the mother has been sensitized that something foreign was in my body. So if you have another child, subsequent pregnancy, whether it was a termination of pregnancy, whatever it was, but you were exposed, and that child, you're now pregnant, the next child has a very high chance of either having a stillbirth from that pregnancy, or the child coming down with what we call hemolytic disease of the newborn. Child is so pale. The child, you see when they say they're transfusing children, you say, can the baby be transfused? Those kind of things can happen. The baby is being transfused. Child is yellow because the red cells are being broken down. So what we do is that once you have that child, we have rhesus negative. We know that you have to take some medication to prevent your child, what we call program. I'm sure a lot of viewers have heard of program, to prevent subsequent pregnancy. And therefore, for the blood group, you are just preventing consequence of what I call fetal death, things that can cause you to lose your child. But for the genotype, it has to be intending couple. That's why we say genetic counseling. Prevention is better than cure. You will not want to have a warrior. You will not want to have a warrior. And the child sometimes blame their parents that if it's not because of you, I won't be here.
We're talking about factors affecting intended couples. We've heard of people who actually, believe that God could change their genotype. I mean, it's real, right? God does actually do change genotypes.
Now, that is from a religious. I'm a Christian, and I believe there's nothing God cannot do. That is where my standpoint is. But medically, we will say no. Medically, we will say no. That is your genetic makeup. Once you have it, you have it. But that's what I'm saying. So for being a Christian, I won't doubt if someone comes out and tell me, oh, my genotype has been changed. With evidence, maybe I've done your genotype test and maybe 3 or 4 places and it's confirmed that it has been changed. I won't doubt that. But medically, I will say no. But spiritually, I will say yes.
So the advice for that aspect is when you think, when you're AS and your spouse to be is AS, I think what you could do is actually believe God to change it before you get married.
Yes.
Isn't it?
Yes.
Yes. Instead of believing that when you get married,
right,
it will be.
Yes.
Okay. So doctor, when we talk about this genotype, we know a lot of people do not know the genotype.
Yes.
Why do you think that is?
One is ignorance. Some people don't really know about this. They have not heard about it. And some, they just believe, when I'm getting married, most churches do genotype, HIV, and pregnancy test. So maybe when I'm getting married, I'll do it. But forgetting that by the time you're getting married, you're already emotionally invested. Maybe years have passed, or you've been courting, or you've been dating. So is it at that point that when they say, oh, you're AS, you cannot marry? Definitely you will not agree. You still want to go ahead. And sometimes the consequence of that decision lives with you forever.
Okay, so doctor, sorry, there's this saying that when a sickler gets to a certain age, he or she outgrows it. Is it possible?
No, that's a myth. And now we don't call them sicklers. We call them warriors.
Okay. These warriors, when they get to a certain age, do they outgrow it?
No, they don't. They don't outgrow anything. That is a myth. And they do not outgrow any of the symptoms, whether the pain, especially the pain. Because the most frequent thing they have, see them in pain. They come down with pain. They come to the hospital in pain. They are missing school because of pain. They don't outgrow that. However, there are medications now that people take to reduce or ameliorate the severity of this sickle cell disease. And a lot of them have done better and have done well on these medications that we have. And some of them are quite expensive, but we have some few that are available here that we can give. But it still costs, it's still money. Irrespective of them being on this medication, once in a while they still come down with pain. Once in a while they are still admitted. Once in a while they are having crisis and they are coming down. Once in a while their blood is reduced, they have to be transfused. Because that's the consequence of the sickle cell. They tend to have reduced, their lifespan of their red cell is not as long as ours. So frequently, their blood is low.
So doctor, what advice would you give to people, to those watching out there? What advice would you give them? At what age should they go and know what the genotype is, what their blood group is? At what age?
Now, for parents, because most schools are demanding for it now, genotype, blood group, before they are admitted into either secondary school, even primary school. I would suggest all parents should know their children's blood group and genotype. Then also, once the child knows that, I knew I was AS at a young age, so I knew I wasn't going to marry an AS. And the first guy I was supposed to marry was an AS, and I refused to marry. Maybe because I was also in the medical line, but also the fear of having a HBSS, as a sickle cell child, was what drove me away. And I said I might not be able to cope.
You certainly wouldn't have been able
Definitely.
to.
So, so all parents should ensure that they know their children's blood group and genotype. And that child grows up with that knowledge that this is my genotype. I'm not supposed to marry this certain group of people. And so before he or she is invested in a relationship, I have a friend that was what he was doing before he got married. If he's interested in you, the first thing he asks, what's your genotype? Jokingly. And if you give it to him, he just starts backing out.
It's very important.
So I think every parent, but at the age of from 6 months, a child's genotype, you can detect a child's genotype from 6 months, because that's when the mother's blood is likely finished from the child. Let me use that terminology, finished from the child. So the child's true identity comes up from 6 months. So from 6 months, you should be able to do a genotype for a child.
So we understand very well that genotype is a problem. I think when I was a long time ago, I remember there was this couple. They had a sickle, a warrior. I think it was their second child, and he was a warrior. And I noticed that at a point, his bones, his legs started coming together. Does it do that?
Well, there's a complication called, well, it's not really coming together, but what we call avascular necrosis of the head of femur. So you see them limping. Those are all the complications. I'm sure a lot of people see them limping. A lot of them, some of them see them with abdominal, big stomach.
Yeah. So, doctor, please, so for those people who already are married and probably, they can't go anywhere anymore. So, what advice would you give them? What advice do you think you can give to them to comfort them, to help them? What kind of advice would you give them?
Well, the advice can give you, if you have a warrior, please don't hide the person. Now we have passed the stage of, it was in those days, the parents used to hide the child and don't want people to see, oh, they have this type of child. You don't hide them. If you come to my clinic, a lot of them come, you won't even know they are warriors because they are so healthy living. They have medications now. They drink a lot of water. Water is therapy to them. So don't hide your child. If a child is a child, we have the pediatric hematology. You can go to chair at the University of Calabar. Don't hide that child. If it's an adult you bring to us, we are very happy to accept them, to take care of them. So don't hide the child. But however, if you do not have one, you can still keep praying. Because I will not tell you to do a prenatal diagnosis, which will be difficult. But if you have one that is a fetus, are you going to flush the child out?
I was going to come to that. Because I know somebody was saying, we have, our technology has so grown now. So even while the baby is in the womb, you can detect if the baby is a warrior or not.
Yes.
Just like you said, what do you think can happen if the baby is detected to be a warrior in the womb?
Yeah, there are technologies that can do that. Okay. But that's where we say medically, not medically, but ethically and morally. Is it justified?
Can I speak it in layman's so they can understand? Because I don't think they understand what you're saying. So
now there are tests that we can do while the baby is still in the womb. So that's what we call a fetus. You have not yet born the child, but you are AS and your husband is AS and you're afraid that particular child you are carrying could it or could it not, and you now want to do a test. So there are things that can be done, and they will collect some things from the baby and test and know whether the baby is AS or SS and all that. So, but if the child comes out to be SS, that's according to church, morally, is it justified to terminate that pregnancy? There are some things that, medically they can say is medical abortion. They call it medical abortion. So some people can say, oh, it's threat to mother, threat to child, threat to this, and therefore they will give you the grant to terminate the pregnancy. But you as a mother, how many pregnancies will you terminate? If maybe you keep getting pregnant and they are all SS, how many will you terminate? Maybe at the long run, maybe for your peace of mind, you can say, oh, I did not have any child. But, according to your Christian faith, is it acceptable to abort a child? So that's why I keep saying prevention is definitely cheaper. And these tests are not cheap. This could be close to maybe 500,000. How many people can keep affording that? So prevention is definitely cheaper.
Okay, so doctor, how, like a lot of people, I actually have asked about 3, 4 people, and they don't even know their genotype. They don't know their blood group. I mean, are you people doing any awareness for people? Are there things people are doing to create awareness? Are there ways people are, are trying to make people know that this is a very, some people just say that they're not, this thing is not serious. How are you people trying to make people understand the seriousness of this?
Well, it's quite serious, and I just wish people will be a little bit more knowledgeable and aware about this genotype thing. Now, June 19th is World Sickle Cell Day, so we always celebrate it. We go to radios, we go to televisions, churches. Yeah, we select some churches that we go to on advocacy. And the advocacy is just prevention, genotype. Know your genotype, genetic counseling before you get married. Intended couple, young people, know your genotype. So we try to celebrate by advocacy and awareness. People should be aware. There's a time we even went for an outreach in one of these Northern Cross rural area, and we're doing genotype screening for patients. And we found that 3 or 4 of the children had sickle cell that the parents didn't even know. They just noticed that the child was always falling ill, falling ill. They have taken the child for all the traditional and everything, but that child kept on falling ill. And it created an awareness, because by the time we left there, we were overwhelmed, because parents now start bringing their children now that they want to know what this child has, this child has, this child. Some of the young girls and the boys were also curious to know what genotype they have, so that they could prevent. So it's just government has to help us out also. This is not an individual thing, it's not an individual fight. So government have to help us, televisions, advocacies. That's just what we keep doing. So when we celebrate the World Sickle Cell Day, we do more of the advocacies.
Yeah, people will say, in those days, just like we're talking before the program started, that, our grandfathers, our grandmothers in those days, some will have like 9 children. You hear that 5 died, you hear that 6 died, and I'm sure they did not know that some of them were just dying. They were warriors,
Yes.
They just felt, oh, witches,
Yeah.
So I am really grateful that you people are creating a lot of awareness, and I want to believe, God, that you watching out there, peradventure you don't know what your genotype is. It's very important. Before you say I do, please check, so that you don't bring children. And okay, doctor, I think I heard about these warriors really blaming their parent for it.
Yes.
What do you say about that?
Well, if you want to look at it, they are justified, because the parents were knowledgeable or they did prevention. I knew their blood group, they won't have married and therefore won't have produced this child. But however, the deed has been done. So what do we do after that? So some of them actually do blame their parents. I had one that came to clinic yesterday, or day before yesterday, and she kept on saying, Daddy, you must rub my leg. I'm having so much pain. After all, if you did not born me, I won't be here. That kind of thing. So, and the father felt, like, call it more of guilt or something. When we were even telling the father, sit down, sir, the man was like, no, I have to keep rubbing her leg. I have to keep rubbing. That kind of thing. That's just a tip of what you are saying outside. You don't know what is going on inside. So the advice I'll give is, know your blood group, know your genotype. If a woman is rhesus negative, please, 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 don't cry, don't do this, that you're losing children, your children are dying from stillbirth. If you're rhesus negative, go to the hospital and they'll give you some medication. I'm not sure it's really that expensive, but to prevent subsequent pregnancies. Then your blood group, your genotype can't be overemphasized. It's very, very important for intending couple. I believe everybody, and that's why churches are also advocating for it, every couple that intends to marry should, as a matter of urgency, seriousness, importance, however you want to put it, know their genotype. Because if you bring out a child, just one warrior in a family is very economical. It is an economic burden, not just the economy. Even if you have the money, financially, emotionally, psychologically, it breaks disunity in the family. Because after some time, the man gets tired and say, oh, madam, I'm leaving, let me go and remarry another woman that doesn't have and will give me children. And once he has a child that is not a warrior, then believe me, he will leave your child and move on with the other one. So you alone as a single mother taking care of a warrior child, you know what it means. So please, prevention. This is where prevention is definitely cheaper and better than cure. So, but however, if you have a warrior, please, they do live well. I have a lot of them that are doctors. I have a lot of them that are lawyers. A lot of them that are doing very well. They are successful business people. They do live well. Don't hide them. Let them take their medication. Let them drink a lot of water. Let them come for their follow-up clinic. We have people that are up to 80 years and they are warriors. We have 70 years, they are warriors and they are doing very well. We have a lot. So please don't hide the child. The important thing is seeking early medical attention.
Okay, please, sorry, before we round up, can you just lay more emphasis on that taking the women taking injections, right?
Yeah, the program.
Yes, please could you just repeat that again so that somebody out there who probably has had 3, 4 miscarriages, 5 miscarriages, and is not sure of what's going on, could you just explain to her and maybe encourage her and tell her what to do one more
Now,
time?
so for women, we have what we call the ABO and the rhesus. Now, I'm talking about the rhesus, and rhesus are like proteins also on the body. If you have those proteins, is what we call rhesus positive. If you do not have the protein, you have rhesus negative. And we have what we call, I'm sure you have a lot of people here, O negative, O positive. So those that are O positive have the rhesus protein. Those that are O negative, they do not have. That's not just O, every other blood group. Now, if you're a woman, this is particular more for the women. If you're a woman and you're rhesus negative, and you marry a man that is rhesus positive, the likelihood of you having a child that is rhesus positive is there. Your first pregnancy, you go home free. Nothing will happen to the child. If that child is rhesus positive, nothing will happen to the child. However, during delivery, during CS, during some maneuver, there is a little bit of mixture of the mother and the child's blood. So once the child's blood enters the mother, it has sensitized the mother that something foreign, because the blood group is, like the rhesus is different. Something foreign has entered her system, so she has developed antibody. That's how the body works. That antibody is just the same way it fights infection. So waiting for subsequent things like this to happen, then they will express themselves more. Now, subsequent pregnancy, if your child is still, that fetus is still rhesus positive, that child is going to be affected, because already since the antibody has been developed, you have been sensitized. Now they now get another foreign thing, they will express themselves more and affect the child's red cell. So that's how that child, the fetus, you can have stillbirth, depending on how bad the affectation is. You can have a child that is born and the child is very pale without blood. They are now looking for, I want to transfuse a newborn baby with blood. Sometimes the child can come back and they say, my child is jaundice. Some women will say, I have a child and the child is jaundice. They say they want to do exchange blood, or they want to put the child on inside light, and all those kind of things. So those things can affect. However, it can be prevented. If you're a woman that is O negative and that your first baby was O positive and nothing happened to that baby, you're not home free. You've just prepared ground for subsequent pregnancies or for subsequent children to be affected. So we have what we call an injection, and it's called Program. When you are pregnant for the next baby, they can give it to you at 28 weeks, and they can give it to you 72 hours after delivery. Immediately you have put to bed, like that first baby that came out as rhesus positive, 72 hours, that's within that period, you should be giving that injection. That injection prevents your body from developing antibody against subsequent pregnancies or subsequent children. So it's found everywhere. You just don't sit down and say, nothing has happened. Then you now start having problem. Your child, you keep born child that they say, they are stillbirth, they are stillbirth, they are stillbirth. That might just be the problem.
Okay. Thank you so much, Doctor. We're
Thank
so
you,
happy to
ma'am.
have you here. So today we have learned a lot. And like Doctor said, all hope is not lost. Peradventure, you find yourself in one situation or the other, as Doctor has rightly said. We just want you to know that all hope is not lost. Do yourself a favor. Go to the hospital. Check your genotype. Check your blood group. Check your child's genotype. Check your child's blood group. And of course, if anything is wrong, remember, we have a God who is able to turn things around. I want you to believe that all things are possible. All hope is not lost. Medically, do what you can do. But at the same time, trust God. The Bible says if you can believe, all things are possible. believe God that God will come through for you. I see God coming through for you in the mighty name of Jesus. I see God coming through. It's not over. Remember, it's not over. So no matter your situation today, either you're a warrior or you have made a mistake, you're AS, your spouse is AS. Let's believe God for the best. Praise the Lord. Doctor, thank you so much for coming one more time. We're
Thank you so
grateful,
much.
and we want to believe very well that a lot of people have listened, they have heard. And we know that questions are going to be coming up. So as the questions come up, Doctor, we'll get to in touch with you. And maybe we could just have another episode so that we could answer one or two of these questions.
No problem.
Thank you so much for
Thank
coming.
you so much for
Thank
having
you for
me.
watching today's episode, and want to believe God that you have learned a lot. You've learned a lot. And as you've learned a lot, remember, no more I did not know. No more I nobody told me. You've been told. May the Lord help us. May the Lord help you in the name of Jesus. And for the warriors, remember, you're warrior. You're called warriors, and you will continue to win in Jesus' mighty name. Doctor said people have lived to 80, 90. I see you living longer than your enemies thought you would live. You will live well, and you will have a better life. You have a good life in Jesus' mighty name. Thank you for watching today's episode. Remember, like the video, share the video. God bless you. See you next time.